So we really just started talking about emotions, or I wanted us to make sure we are distinguishing emotions from emotional behaviors. There are two major components of emotion. So the physical component and the feeling component. The physical component, we might see a rapid heart rate, we might see someone start breathing harder, we might see some galvanic skin response difference. We can measure physical measures of emotion. The other component, the feeling, whether someone is feeling scared or happy or excited or nervous, those are feelings and they are unobservable. So we are making some assumptions about people's feelings unless we're directly asking them. And to some extent, I'm going to continue to argue that even as we are interpreting our own physiological response and our own experience, we are interpreting to some extent our own feelings, and where that interpretation comes in is kind of the question. I had here to the right the circumplex model that's included, where we see in the vertical we're talking about how aroused someone is. Are they neutral, aroused, or not aroused? Not aroused at the bottom. And then from the left to right, we're talking about somebody's valence. Okay, so just their mood. Is it negative, neutral, or positive, moving from left to right? And if you see, so if I'm going to say that I like the difference, one difference I like to talk about is nervous versus excited. So I'm pretty aroused, and I could interpret that. It could be I'm aroused because I'm nervous. It could be that I'm aroused because I'm excited. And really my interpretation of that arousal is going to be, to some extent, dependent on not just what's happening with me, but partly on my mood, right, and my overall valence. And so if I'm not very happy about what I'm doing and I'm aroused, I might experience this as nervousness. But if I'm pretty happy about what I'm doing, and I'm using the word happy even though I don't like using that word necessarily, because I want to say if I'm pretty excited about what I'm doing, but I'm using the same word. But if I'm pretty happy about what I'm doing, or I have a pretty positive valence about what I'm doing, and I'm pretty aroused, I might interpret that as being excited about what I'm doing. And so that's a really different interpretation of a very similar physiological response, and it really depends on valence. If we go towards the down into some of the really feeling not aroused, if I take the same, again, the same levels here, if I'm not very aroused and I'm in a pretty negative mood or negative valence, I might feel pretty depressed. But if I'm really not aroused and I'm in a pretty positive mood or valence, I might consider that or interpret that as being just feeling pretty serene, which is a pretty nice feeling. So we're going to walk through a number of theories of what's happening with this physiological component of emotion. And the common sense kind of way to think about this is, so I see something that's threatening, like a grizzly bear. I feel a sense of fear, and so I have, my heart starts pounding, I'm trembling, sweating, and running away. What William James and Carl Lange, so William James, the psychologist, and Carl Lange, a physiologist, back in the late 1800s, suggested was actually our common sense of feeling of how this occurs is backwards, that what we're doing instead is we're perceiving the stimulus, this scary, threatening grizzly bear. We're having some autonomic nervous system arousal or the physiological response. My heart's pounding, I'm trembling and sweating, I'm running away, and that is leading us to the emotion or the feeling of fear. Another theory of how this works comes from Walter Cannon and Philip Bard, and they suggested that the mind and body are experiencing emotion independently and that this is happening simultaneously, so such that our autonomic nervous system, sympathetic nervous system, the arousal is happening, that's occurring at the same time and simultaneously with when the brain, with the cortex, is experiencing the experience of the emotion. Okay, so I see the threatening grizzly bear, and at the same time that happens, my heart starts pounding, I'm trembling, sweating, and running away. At the same time, simultaneously, I'm feeling a sense of fear. And finally, almost 100 years later, so more about around the 1960s, Stanley Schachter and Jeremy Singer came up with their two-factor theory of emotion, where we're having a physiological response, and depending on the situation we are in, we're going to have a cognitive interpretation, or what we call an emotional label, and we then feel emotion. So just to distinguish the James Lange theory, we have a physiological response, and then we have some kind of interpretation of that response to feel the emotion. In this case, what they're adding is really this cognitive component, and that we are labeling the physiological response before having the actual emotion. So we have an extra block in there of cognitive labeling. So we see the grizzly bear, or whatever threatening stimulus, we have that physiological autonomic nervous system response and arousal. We have the cognitive label, that is one scary bear, I'm afraid of it, and then we feel the emotion of fear. And this is just a picture from, I think, the first Psych 101 textbook that I ever taught from. This author put all of those possibilities together in a single picture for a really clear kind of comparison. And if this helps you, then that's great. And you might actually want to go to the PowerPoints and pull this out so you can see it all kind of together. But if it doesn't help you, then you can ignore it. I am going to state just one thing here, or make a point, that your author brings up this fact that William James, years later, after proposing this, I see the stimulus, I have a physiological arousal, my autonomic nervous system responds, and that leads to a conscious feeling, that he put in there a cognitive appraisal or a cognitive label. And it was really different than the Schachter cognitive label, because how he talked about it is there's the stimulus and you give that a cognitive label. You basically see that and say there's a scary barking dog. And then you have the physiological arousal, which leads to the conscious feeling of fear in this case. And that appraisal for the Schachter, what I call the Schachter Singer, but this author is just giving the credit just to Schachter, that you see the stimulus very automatically and very quickly. You have that physiological response, the autonomic arousal, and then you go in and have a kind of cognitive appraisal that is more thoughtful before knowing or really having a conscious feeling of fear in this case. Walter Cannon was the first person to understand that the sympathetic nervous system is, as a system, is this, he didn't realize then that it was those chains of ganglia that are closely linked, but he saw the system as being all very closely linked, that we are having this brief, vigorous fight or flight response, and that this means various different aspects of our body are behaving in a certain way all at the same time. So he had this realization of, I'm breathing more heavily, I'm taking in more oxygen, my heart is beating faster, I'm starting to sweat. All of that is happening at the same time in this kind of very fast response for the fight or flight abilities. But really, different situations can evoke a mixture of sympathetic and parasympathetic arousal. One of the examples the author gives is to talk about nausea. So nausea is associated with the sympathetic stimulation of the stomach. So we see, just like when we are getting ready for fight or flight, we have less kind of energy put to digestion. So we see this decrease in the contractions of the stomach when we are nauseated. But at the same time, we see increased stimulation of the intestines and of the salivary glands. So as you know, when you're feeling nauseated, you have that kind of salivation in your mouth. So that is both a mixture of the sympathetic and the parasympathetic nervous systems stimulating different organs, different aspects of our bodies. And another example he gives that is a really good point that I can't remember if I've already made it in this class or if I make it again somewhere, but that fight or flight response is not necessarily just a fight or flight response. It's a fight, flight, or freeze response. And the freezing that an animal does, especially those prey animals, right, they'll just freeze because they're less likely to be seen. If they are completely still, this means a decrease in heart rate because again they want to freeze. So even that is a bit more complicated than just it's fight or flight, which is the sympathetic nervous system arousal. And here I bring up this distinction that we want to make between emotions in comparison to moods. And I ask the green question of what is the difference, because I was really hoping to get to this on Monday and to have another place to maybe have a little bit more discussion, because it really is fun for me when you all are a little more engaged and discussing, and it's not just me lecturing. I wasn't sure how much discussion this would actually give us, but if we ask what the difference is, and you can stop this and think about that for a moment. And I'm giving some silence so that you do think about it, even if you don't pause this momentarily. I haven't put this in here before, but I would assume that people are pretty aware of this idea that we have a lot more specific kinds of emotions. Those emotions tend to be more fleeting and can be in response to particular events, versus moods tend to be more long-lasting and they're not as specific, right? I mean, we're generally usually in a good mood or a bad mood, and there's not a lot of specificity, or there aren't a lot of differences in all of that. And you might even put mood on this circumplex model. You might equate it with valence, although I'm not really sure that's a good one-to-one clear correspondence, but it's pretty good. And then I just want to come back to the circumplex model while also having you think through some of these aspects of emotional experience that we just saw the different theories of emotion including. So that subjective experience, that physiological response, and the cognitive appraisal. And especially it's good to think, I think, it's good to think through some of those with more different emotions than just what they usually show in the textbooks is a fear response in those pictures. But some of those, so a physiological response that is up there at excited or nervous might be also some amount of fear or some amount of anger. And while those all seem like a kind of negative valence, and they seem maybe somewhat related, they are not the same emotion. And so how we get from that physiological response to really the subjective experience of a feeling, of an emotion, is something I think you do want to think about. Okay, so I'm going to walk us through a number of pieces of evidence for and against the different theories. And so I'm going to try and make it clear when I'm talking what theory this is really evidence for and what theory this might be really evidence against. But sometimes I might not touch on both of those really clearly. So you might want to just get that picture with the summary picture, or write down really quickly your own kind of summary picture to think through what is this evidence suggesting. Okay, well, one piece of evidence that really suggests that we need the autonomic nervous system experience in order to have to feel an emotion, and so maybe it is coming first. So really, a piece of evidence for the James Lange theory, potentially for Schachter Singer as well, but really for the really clearly for the James Lange theory, is the people who have pure autonomic failure. So all the body systems are working just fine. I'm still, my heart's beating, I'm breathing, and everything's okay. Except what's happening is the output from the autonomic nervous system to the body is failing. So the sympathetic nervous system isn't having the influence that it usually does. What these people report is they have a reaction to stressful experiences. They report having the same emotions as anyone else. And if you're telling them a story, and they're hearing about a character, they can tell how characters in the story must feel. However, when they state they're feeling emotions, they're clearly feeling them much less intensely than before they had the pure autonomic failure. And they'll say things like, "Of course I'm angry. That's offensive to say." Okay, I'm trying to do this. So normally when we're angry, you can hear it in our voice. Of course I'm angry. That's offensive to say. But they'll state their emotions and they'll say they're experiencing this emotion, but it's really without the intensity that we feel, that we tend to feel emotions. So I have a couple more pieces of evidence here suggesting that physiological arousal appears to be necessary for emotions, which would support the James Lange theory. One, your author mentions that Botox, so the botulinum toxin, it blocks acetylcholine at the neuromuscular junctions, and so they'll inject that into the frown lines on the face, so the person is unable really to frown. Right, those muscles are temporarily paralyzed. And they report, when watching short videos, they report less emotion in response to those videos. We also see if we give them something sad to read, they read more slowly in that if they had the Botox injection. Another piece of evidence is the facial feedback hypothesis, which I have a picture of how they got this to kind of work over to the right there. So a person would either hold a pen between their lips or sometimes between their nose and lips, as you get that up between your nose and your lips, or in your lips, so that whichever way you do it, you kind of have to make a little bit of a frown, but not really a strong frown. But the other way, so if you hold a pen between your teeth, it really kind of forces you to smile. And then they had them read comics, and the people who had the pen between their teeth so that they were smiling rated the comics as funnier. So this evidence all points to the notion that feeling a body change is important for experiencing emotion. Now I have one more example, even though it's not evidence, it is an example. But the idea is that, or what these people are trying to do is to induce an aggressive, warlike state by creating these particular emotions. And so I have a picture to the right of this particular tribe that originally did this, some Aboriginal tribe, and then in the middle is a soccer team that is using the same kind of war dance in order to induce emotions and induce a particular state within themselves. And I do provide this link underneath, in Blackboard. So is physiological arousal sufficient for experiencing emotions? Is all we need is the physiological arousal? Well, if our heart starts racing and we're sweating and breathing rapidly and breathing in a lot of oxygen, do we feel an emotion? It really depends on the situation, right? I mean, most of us have gone running or exercising at some point, and we didn't feel like we were having some kind of emotion because of that. So maybe not. It really does appear to depend somewhat on interpretation. But if all of that occurs spontaneously, so you're not exercising and your heart starts racing and you're sweating and breathing heavily, you might interpret this increase of activity of the sympathetic nervous system as fear. And in fact, it looks like what panic attacks are made of, that the person is having this physiological response, and then they're interpreting that as being afraid, and that continues on. It kind of spirals out as that response gets even stronger, and then they start to feel like maybe, I mean, this gets to sometimes to the point of feeling like you're having a heart attack or something because you're panicking so badly, partly just due to, or really just due to, this spontaneous autonomic nervous system activity. So I'm going to include one more study that questions whether physiological arousal is sufficient for emotions. And this comes from Stanley Schachter, Jeremy Singer, and supports really the two-factor theory. This was their study done back in the 60s, where the participants are injected with epinephrine, so that's going to cause some autonomic nervous system response. Half of those participants are told this is a shot of epinephrine, and you're going to have, your heart's going to start racing, your hands are going to get clammy, you're going to get sweaty and start breathing hard. And the other half of the participants are uninformed about what this injection is all about. And then they split those people up such that we have people in this euphoric condition, half of whom are informed, half of whom are uninformed. All right, all randomly assigned. The euphoric condition looks like this, where they are supposedly waiting for the experiment, and they are in there with a Confederate who's also supposedly waiting for the experiment, and the Confederate is just throwing paper airplanes and having a good time. Okay, and then the other half of the participants are in the angry condition, and again, half of them are informed, half of them are uninformed, all randomly assigned to these conditions. And the poor people who are uninformed in the angry condition, you can see this was the not good condition to be in, which sometimes happens to us in psychology experiments. So in the angry condition, they have them sit down and answer questions that are sometimes offensive, like, how many men has your mom cheated on your father with? So it's like these offensive questions, and they're in there again with the Confederate, and the Confederate is behaving as if he's angry, and gets up and balls up the paper and throws it in the trash can and slams the door. So they're in the angry condition. And as you can see from the pictures, what they found was, in the euphoric condition, we have the informed participants not really experiencing a lot of euphoria, although if we're looking at the figures down at the bottom, they're experiencing some euphoria, just not much. What that says there, if I can read it okay, is, heart's pounding, hands are trembling. I guess that drug really works. The uninformed participants are just, if you can read that, just whoopee, they're just having a great time, and they are experiencing some euphoria. For the people in the angry condition, the people who were informed are, again, if you look at the figure over to the right, the data, they're not really feeling any of the behavioral symptoms of anger at all. And again, they're sitting there thinking, heart's pounding, hands clammy. I guess that drug really works. And these are just idealized what they're thinking, but obviously they have an explanation, right, for this autonomic nervous system response. Whereas, again, the poor uninformed participant who's in the angry condition is experiencing behavioral anger. They are experiencing anger. So this suggests, right, that we have a physiological response, and we have a potential emotion to this response. And that potential emotion to the response, first of all, is going to depend on the situation. Am I in a euphoric condition, or in a place where I can be happy, or am I in an angry condition, a place where I might end up being upset? And that's going to influence me. But also what influences me, right, is my cognitive appraisal. If I know that what I just had was an epinephrine shot, or that I'm going to have this autonomic nervous system response, then all I'm saying is, oh, that drug works, and that's why I'm having this response. And we can have some explanation for our physiological response, and it doesn't influence so much our emotions.